Breast cancer patients who have a mastectomy can be left with physical and emotional scars, but reconstructive surgery can help a woman look and feel better.
Good morning.
Hi, how are you?
Plastic and reconstructive surgeons like Dr. Erich Lemker treat every breast cancer patient with customized approach. He explains how some women feel after having a mastectomy.
It's a very deforming surgery, a mastectomy, and so it can be something that really affects their overall mental health and well-being.
It's his job, he says, to help women with breast cancer feel better through the advances of reconstructive surgery.
Really, we have three options for reconstruction: implant-based, autologous, or using their own tissue, and then a combination of the two. Oftentimes, the combination of the two we save as a backup option in case patients have difficulty with radiation or infection.
Dr. Lemker says about 80% of his patients choose the implant route, but some opt to have their own tissue used, which is a surgical procedure called a flap.
Using your own tissue means that we often borrow tissue from another place on your body. Usually the lower abdomen has ample donor tissue, and then we completely detach it and then reattach it to the chest in order to recreate the breast.
He says there are pros and cons to both options. With implants, the surgery time is shorter and the recovery time is faster. However, with the flap surgery,
the benefit of that is once everything is done and healed, you're much less likely to need revisions in the future. There's no foreign bodies, and so it's often a great way to maintain the durability of the operation.
Dr. Lemker also explains some women may have immediate reconstructive surgery, while some delay it.
So immediate breast reconstruction is done at the time of mastectomy, and so it's one surgery. The patient has the mastectomy and the reconstruction, so when they wake up, they never have to go through a period where they feel deformed or missing that tissue. Delayed reconstruction means that we don't do it at the same time, and so oftentimes that'll be completed either after radiation, or sometimes patients just aren't ready to go through the reconstructive process at the time of their mastectomy and choose to delay it months to years later.
Dr. Lemker says reconstructive surgery can help a woman heal from the physical and emotional scars of a mastectomy.
If they've had a delayed reconstruction, they will often identify the reconstructive surgery as the one that cured them, not the mastectomy that removed the cancer. And so it's a very, I think, very important thing for overall mental health and well-being. Our role here is really to help them make the best decision for them.
For more information on Community's Plastic and Reconstructive Surgery Department, visit communitymedical.org/reconstructive-surgery.